Welcome to Physicians on Health. This video is the accurate English translation of Dr. Ray's health video. The original content was created in Chinese by Dr. Ray, a certified medical professional. Today's topic is how to count days and more ways to avoid pregnancy or to have a baby. How to calculate a woman's ovulation period, fertile window, and menstrual cycle. Understanding the menstrual cycle is very important for women, as it indicates overall health, the fertile window, and the ovulation period. A missed period is one of the signs of pregnancy, but when should you see a doctor if your period is late? Today, let's explain everything clearly. Understanding the menstrual cycle. From the moment a woman gets her first period, the concept of the menstrual cycle becomes an important part of her life. The most common term associated with it is ovulation period. Many women know what ovulation is, but they may not know exactly how to calculate the ovulation period. This lack of understanding can sometimes lead to unplanned pregnancies. Each menstrual cycle can be divided into 3 phases: the menstrual phase, the ovulation phase, and the safe period. Ovulation phase. For women of childbearing age, ovulation is a monthly event where a mature egg is released from the ovary. For women with regular menstrual cycles, ovulation usually occurs about 14 days before the next period. However, this can vary among women, and not all women have a 28-day cycle. After the egg is released, it can survive in the uterine tube for 1 or 2 days, waiting to meet a sperm. To be cautious, people often consider the 5 days before and 4 days after the ovulation day as the ovulation period. For example, if your menstrual cycle is 28 days and your period starts on the 1st of the month, then the ovulation period will be from the 9th to the 18th. For a 28-day cycle, ovulation day equals 28 minus 14, which equals the 14th day. Typically, the fertile window is about 5 days before and 4 days after the ovulation day, so from day 9 to day 18. If your menstrual cycle is 27 days and your period starts on the 1st of the month, then the ovulation period will be from the 8th to the 17th. For a 27-day cycle, ovulation day equals 27 minus 14, which equals the 13th day. Typically, the fertile window is about 5 days before and 4 days after the ovulation day, so from day 8 to day 17. If your menstrual cycle is 26 days and your period starts on the 1st of the month, then the ovulation period will be from the 7th to the 16th. For a 26-day cycle, ovulation day equals 26 minus 14, which equals the 12th day. The fertile window is about 5 days before and 4 days after the ovulation day, so from day 7 to day 16. Having sex during the ovulation period increases the chances of pregnancy, so it's also called the fertile window or fertile period. If you want to get pregnant, this is the best time. If you are not planning to have a baby, you should take contraceptive measures during this period. 3 ways to quickly identify the ovulation period. Method 1. Menstrual calculation method. For women with regular cycles, count 14 days back from the next expected period date to find the ovulation date. This method works best for women with regular cycles and is not reliable for those with irregular periods. Method 2. Basal body temperature method. Measure your body temperature every morning between 6 and 8 a.m. under your tongue for 5 minutes. Record the temperature daily for 5 days. If you notice a pattern where your temperature is low first and then rises, that period is considered your ovulation period. Method 3. Observing cervical mucus. During the ovulation period, vaginal discharge often becomes clear and stretchy, similar to egg whites. Other signs of ovulation can include mild pelvic or abdominal pain, also known as mittelschmerz, a slight increase in sexual desire called libido, and changes in the cervix position and firmness, where the cervix may become softer and move higher in the vagina. When to see a doctor about a late period. If you have a regular menstrual cycle and your period is more than 10 days late, it's a good idea to see a doctor. Alternatively, you can buy a pregnancy test to check if you might be pregnant. Medical disclaimer: the information provided here is for educational purposes and should not replace professional medical advice. Always consult with your healthcare provider for personalized guidance and support. Thank you for watching. If you found this video helpful, please tap the thumbs up icon below the video to like it and share it with others who might benefit from it. Don't forget to subscribe to our channel Physicians on Health by tapping the subscribe button below the video. After subscribing, tap the bell icon to receive notifications about our latest videos. We appreciate your support.